how soon will major EMRs have FHIR APIs available? Will EHRs offer their open APIs for free?
Gosh, that's the $10 billion question. I think it's absolutely accurate to say that every major EMR vendor, especially obviously those participating in Argonaut, are already claiming to have a FHIR API on their product. So available on product and in production and available in your machine room, I think are two different things of what does one have to do to get on the, if I'm on Epic version 2013 and Epic version 2016 is the one with FHIR, that alone is a 6-month project for me and my entire IT organization and clinical staff. It's a $5 million project for me to go from one version of Epic to the next. That problem has to be solved, or I'm running version X of a vendor's application and I need to install a module that turns FHIR on. It isn't clear whether those vendors are going to give those red boxes, those modules, away for free. It's also not clear if they're going to give full CRUD, as we say, create, read, update, and delete access. I think a lot of them, at least in the context of Argonaut, are doing read-only. So you can query and interact in a very small way with your FHIR API, but you can't do everything. So this is, again, it's playing out over time. I hate to use the analogy because it didn't turn out well, but when is the United States going to adopt the metric system that I heard about so much as a kid? And, with the exception of a few things like liters of Diet Coke, we don't have a lot of adoption yet, even today, some number of years later. And I think FHIR has got some of the same attributes that it's going to solve problems first and foremost that aren't solvable today. So that's why I think Smart on FHIR is cool, and I think that it does solve a problem that is not otherwise solved. And I think the workflow process is going to drive a lot of this, that as vendors use FHIR internally, they'll expose those capabilities to their customer base. So it's hopefully not like waiting for Godot, where it may or may not ever show up, but I think that a lot of vendors have said a lot of very positive things about FHIR. There's a bunch of vendors that are attending. We've done, I think it's 17 or 18 interoperability tests at the HL7 organization. I see all these vendors participating, and I see the depth of functionality they have. And at least in the lab, this stuff is all coming together pretty quickly in comparison to how long it's taken the industry to adopt HL7 v2. So the wild card in the answer is meaningful use stage 3, and the requirement that theoretically the requirement that we are going to require a standards-based open API in order to be MU3 certified. And whether meaningful use continues to play an interesting part of product planning and reimbursement strategy will be figured out.